Hello OET champs, welcome to my channel. My name is Dr. John and I am an OET, IELTS and spoken English trainer. The most important part of the role play card will be tasks. And for each task there is an important verb that tells you exactly what to do, like explain or highlight. In this video we are going to learn all the key phrases you need for every possible task. If you're not yet a subscriber to my YouTube channel and you have an OET test coming up, then I strongly recommend that you click the subscribe button for high quality, trustworthy preparatory videos. So here is an example of a role play card. For each task there are important verbs. These important verbs tell you exactly what you need to do. For each of the tasks you can see that this role play card, the important verbs are find out, request, explain, highlight, reassure and suggest. There are 7 of them. Of course, when you do the role play on your test day, there'll be lots of back and forth in between each task and things will get kind of messy because in effect you're having a conversation, but the important verbs should mark the beginning of each new task. But how will you know which important verbs you might get on your test day? Well, I did an evaluation of a score of OET roleplay cards to come up with the following list. On your test day, you might have to request information as indicated by the verbs find out and ask. You may have to check understanding as indicated by the verbs check or determine. You might have to give information as indicated by the verbs explain, advise, recommend, outline, suggest and discuss. You might need to change the patient's mind as indicated by the verbs persuade, emphasize, stress, reinforce, promote, convince and express concern. And you might have to make the patient feel better as indicated by the verbs allay, reassure, encourage and respond to. As we go through this video, we are going to hear from Chris. Chris is one of my companion and he is going to play the role of the medical professional and demonstrate to you the key phrases that you need for each of those verbs. Great! Let's firstly learn some key phrases to request information. Requesting information will be indicated by the key verbs find out or ask on your role play card. Listen to how Chris requests information.
Miss Smith, I would like to find out more about your headaches. Would you mind telling me when they started?
So Chris explicitly told the patient he would like to find out more about and then use the phrase would you mind? Some other key phrases that you can use to find out or ask would you, or do you mind, would you, or could you please, do you think you could, do you think it would be possible to, would be possible for you to, could you possibly, I would appreciate, etc. These phrases are clear, polite and grammatically accurate and work great on your test day. To request information, the next phrases we learn will be about checking a patient's understanding. These will be based on the key verbs check and determine. Checking and determining mean similar things. Listen to the way Chris transitions from one task to the next and uses the actual word when he starts the new task to make it clear to both the patient and the examiner. Let's listen now.
Thanks, Miss Smith. Now that I know when these headaches started, I would just like to check whether you are taking any medication. Can you tell me about your medication usage?
Well, did you notice how Chris could have said the word determine as in I would like to determine, but this would have sounded a bit unnatural. So he went for the simple word check, which worked great. Now that we have checked or determined what the patient knows, the next set of phrases are related to giving information to the patient. These phrases relate to the key verbs on your role play card explain, advise, recommend and outline. These key verbs all have a similar function. Now let's listen to Chris giving information and making it explicit.
Thanks for letting me know, Miss Smith. I would now like to explain to you when and exactly how much medication you should be taking. Is that okay with you?
Did you notice how Chris first thanked the patient, creating an atmosphere of respect? then told the patient explicitly what he intended to do, which was explaining something to her and then asking her for her permission. These are the types of speaking skills that the OET examiners love to hear. Now, sometimes the patient will be a little bit resistant, and in which case you may have to change the patient's mind to accept something that they're reluctant about. The key verbs you might see in your task card might include persuade, emphasize, stress, promote, convince, express, concern, or reinforce. Now listen to Chris persuading the patient to accept or do something that she is reluctant to. Accept or do the patient will always give in, but you need to use the right language and change the tone of your voice in order to persuade the patient. Let's listen to Chris.
I understand that you might be reluctant to change medications, Miss Smith, but I want to stress how important this is. You see, the medications you are currently on is not suitable for the types of headaches you have been having. The new medication is much better suited. Do you have any issues with that?
Did you notice how Chris used the explicit phrase, I want to stress the importance of, and did you also notice that he changed his tone? He was polite but serious. He also invited the patient to raise any further questions. He had some other phrases to persuade the patient, might include, it's critical, that's really important, that I can stress how important I am certain, I am sure that you can see what needs to be done or what we need to do. I ask you to think about if you move forward with etc. Okay, let's focus on the final task type. To make the patient feel better, the need to empathize with the patient will be indicated by the verbs allay, reassure, encourage, and respond to. The patient will always have concerns. You need to find out what their concerns are and then address them using an empathic tone and appropriate language. You might actually use the verb from the task card in your response. Listen to how Chris makes his patient feel better about changing medications.
I understand that changing medications can be daunting, Miss Smith. After all, you have been taking the same medication for quite a while. But I want to reassure you that the new medication is much safer and will be much more effective than your current medication. How does that sound?
Chris has used the key verb reassure in his response to the patient, and he has used a lot of language around his response to actually reassure the patient. He has reframed her concerns, given reasons why, and then asked if she's okay about it. This is a great response. So just to summarize, on your role play card will be tasks, and these tasks have key functions indicated by key verbs. You might have to request information as indicated by the verbs find out or ask. You might have to check understanding as indicated by the verbs check or determine. You might have to give information as indicated by the verbs explain, advise, recommend, outline, suggest, and discuss. You might have to change the patient's mind about something as indicated by the verbs persuade, emphasize, stress, reinforce, promote, convince, and express concern. And you might have to make the patient feel better as indicated by the verbs allay, reassure, encourage, and respond to. Thanks very much for watching. Remember that if you need more speaking help, including greater speaking mock tests, then check out my channel. Thank you and